weeks ago, Jackson County moved to high, allowing indoor dining for the first time in months. Just 2 weeks later, it moved to extreme. But thanks to a governor-created 2-week grace period to allow counties some time to get their COVID numbers down, we haven't officially gone into extreme. That could change this week. NBC5's Mariah Mills spoke to Jackson County Public Health to see where the county's headed. She's live in studio with our top story tonight at 6. Mariah?
Craig, being in the high-risk category has allowed businesses in Jackson County to partially reopen business and get back to a sense of normalcy. But if COVID cases don't get under control, they could shut back down. I'm pleased to report Jackson County Dr. Jim Shames says he believes we will be in the high-risk category.
I think the numbers will continue to go down, and we ought to see ourselves moving into lower risk categories.
A light shining at the end of the darkness. COVID-19 case numbers continue to lower in Jackson County, according to Public Health Officer Dr. Jim Shames.
I think in terms of cases per 100,000, and I'm pretty sure that we're well below the extreme level. I think we're going to stay at high.
Dr. Shames says the magic number to be considered extreme risk is 200 cases per 100,000 people per week. He says Jackson County is at 168 cases per 100,000, meaning it's very likely the county will stay open and could even reach the lower risk levels in the coming weeks or months.
You know, the numbers bounce around, but lately they've been really pretty low, which is wonderful news.
Dr. Shames believes numbers are dropping thanks to a successful vaccination rollout across the state.
I think the vaccine rollout is really finally taking hold. I think people are doing a really good job of wearing their masks and being distanced and taking this disease seriously.
Despite things going in the right direction, he says there are still some small concerns.
Jackson County, the whole state, the whole country, we have things to worry about. We need to be concerned about another wave. We need to be concerned about, the mutated viruses that make things a little more infectious and more risky.
Dr. Shames says he agrees with President Biden's assessment. Life should be back to normal by July 4th. He believes that's the case because the COVID-19 vaccine should be widely available to everyone by then.
I would take the vaccine that you have access to when it's your turn. If it's Moderna, great. If it's Pfizer, great. If it's Johnson & Johnson, great. If it's AstraZeneca, great.
Josephine County just moved into the high category 2 weeks ago. Even if it qualifies for extreme, it will be allowed to stay at high thanks to the state's 2-week grace period that Jackson County is currently in. Only Coos and Douglas counties are extreme today. Live in studio, Mariah Mills, NBC5 News.